Being homeless with 3 children has been very difficult, and living in a shelter or living in one room, a very small room, and trying to figure out how I would eat most days was very difficult.
I was pregnant. I was homeless, living in a shelter with my 4-year-old son, and that initial shelter was infested with mice.
I felt very lonely. I felt very discouraged. I felt afraid, and I felt like a failure.
In 2015, the head of care coordination at Brigham Women's Hospital came to me to tell me about this enormous need, which was women who were homeless and pregnant coming to the Brigham for obstetrical services. These women get down to the front door in the wheelchair and they're discharged. And instead of getting into a waiting car, many times they're hailing a cab from the curb.
Many scenarios have forced women to this desperate situation of needing to get ready to care for another human being, but now can't even care for themselves effectively and feed themselves.
So we established Bridges to Moms as a way to address that need.
I found myself homeless due to domestic violence.
I am a full-time student. I am working 2 part-time jobs. However, the money still doesn't make up what I need.
We started reaching out to these women with a team from Healthcare Without Walls. And this team was comprised of a nurse and a community health worker.
They have put themselves out there in the past. They have trusted other healthcare providers, and nothing's happened.
Some of these women in the beginning wouldn't answer our calls. They weren't quite sure, like, who are these people?
While being in the shelter, I always felt like it was just people just being fake or just ingenuine, not really caring about doing their jobs.
We're there. We are there to get them into the right clinics, get them into the right places, get them to housing, and the trust is built over time.
It's really a no judgment zone. Wherever they are, we try and meet them there and take them forward and utilize any resources we can find, which is sometimes creating a bed out of dust, honestly. But our community health workers are magical. I can't believe what they pull off.
When Joanna and Ruby came and they looked around and saw what was going on, I had been trying to advocate for myself with the shelter and telling them what was going on, and nothing was happening. Not only was it infested with mice, but it was on the 3rd floor. And because of my other medical conditions, I had already fallen up the stairs and down the stairs several times while being pregnant. But as soon as they came, and Joanna and Ruby, they made phone calls and they switched me into the scatter site that I'm now in.
When I met with Katie and learned about Bridges to Moms, she was attentive and she listened to me and she was patient with me. She didn't interrupt me.
I really feel like this is a sisterhood, it's a family.
I felt safe. I never felt that way before with trying to seek help.
They're like family to me, so I feel free to talk to her. She understands my situation.
Do you have safe housing? Are you safe? Do you have transportation? Do you need food?
They give me taxi vouchers, I get meal tickets, and I also get, Ruby comes to my appointments sometimes, so I at least have a support person.
Traversing the healthcare system has been extremely difficult for these women.
We actually bring ourselves with our medical bags and go to wherever the client is, whether it's a Dunkin' Donuts lobby or their shelter space or even their car. That model of home-based care takes the patient's anxiety level down because we're willing to come to her, and it eliminates some of those barriers to care, like lack of transportation or concerns about judgment from whoever they may encounter in the hospital or clinic setting.
If they are stressed about being poor, being unsafe, being hungry, having their children be hungry, not getting to their appointments, not having their diabetes checked, not having their blood pressure checked, their serum cortisol levels are going sky high. And that's going to contribute to preeclampsia, which is one of the most common conditions that causes premature birth in this population.
When I had the baby, they came to visit me and they'd be so helpful with the baby clothes, toys.
We have been able to show better birth outcomes, longer gestational age, shorter hospital stays, shorter NICU times.
It was so hard for me to get along with the baby with just the car seats, and dragging the 3-year-old was so hard for me. So I told Katie, I need a stroller, but I know you guys can only give me one stroller for the baby, but that wouldn't help me because I would need stroller for the girl. So when she came, it was the double stroller. That was amazing. It was a big relief for me and the kids. And my daughter, she loves it so much.
Thank you. Thank you so much.
There's a lot that's broken in our healthcare system, but this is a program that works. This is a program that has direct impact and affects birth outcomes and ultimately saves a ton of money for the culture at large.
We are saving the healthcare system and the taxpayers millions. We are preventing thousands of emergency room visits. We are preventing crisis care. We are preventing chronic diseases from getting out of control. And the average person should be invested in that because that's your taxes that we're talking about.
This is a long-term problem. I think that all key players need to come to the table.
This is a program that is clearly transforming lives, saving lives, reducing foster care. And what I would love to see would be to take this program to every hospital in Boston. I'd like to create a communication system that involves software that is HIPAA protected, that allows us all to talk to each other so we know where these women are. It's a transient mobile population and we need to be able to follow them. And ultimately, I want a building. I want a building where these women can stay throughout their pregnancies close to the hospital so they don't have to travel in from Lynn and Brockton and Springfield when they're high risk and they're scared for their babies. They would be safe and they would be taken care of until their babies were safe. And then we would work with the housing department and we would fast track these women into decent housing. And if that could happen, that would be my legacy and I would be very happy with that.